Hello, my name is Dr. Louis Sclafani, and I'm the Health Director for Medical Products Online. Today, we're going to discuss the MPO 5000, which is a TENS unit. Please remember that a TENS unit is used to block pain. Also, please remember to consult with your own medical doctor when it comes to these conditions and the use of these devices. Let's open up this device and see what it comes with. We have an instruction manual, electrodes, lead wires, the MPO 5000 device, and a battery. Now, when we look at this device, if you open the door, you're going to see that there is a mode and a set button, and an increase and a decrease button. At the top, you'll see that there's a safety cap. The safety cap is for these dials that are here. These dials, when we turn them clockwise, you're going to hear a click, and you're also going to hear a bleep. Then you'll see the numbers appear on the front of the unit. That means it's on. The dials at the top, when you rotate them in a clockwise direction, it increases the strength of the electrical impulse. So when you turn it on just to the point where you hear the click and the beep, and then there is no electrical impulse coming out until you rotate them more clockwise. Let's go through the modes. This is a 5-mode device, a 5-mode TENS unit, meaning it's a very high quality unit. So if we open up the door and we press mode, we're going to see that it goes from burst mode to normal mode, modulation mode, SD1 and SD2 modes. The burst mode. The impulses are going to come up and down, and then they're going to go flat, so there'll be no impulse, and then that will repeat. That will repeat on and on for the duration of the treatment. When we're in the normal mode, basically what happens is you just get impulses throughout the treatment. In the modulation mode, what happens is the pulse width will vary from a short pulse width to a longer pulse width, to a short pulse width and a longer pulse width. What that will do for you is to actually change the character of the electrical impulse. In SD1 mode, basically what happens is the strength and the pulse width are varying throughout the treatment. It will go from high to low and back up to high. In the SD2, it does a similar pattern, but what happens is the strength will vary more from top to bottom. So it'll go like this. When it comes to setting the pulse width variation from higher to lower will make the electrical impulse feel stronger and less strong. When we're going to the pulse rate, what happens is the actual pulses per second that you feel will increase and decrease. A shorter pulse width will feel stronger and more biting, and a higher pulse width will feel less strong and also will feel smoother. Let's hook up the device. I have electrodes here. These are self-sticking electrodes. You would want to keep these electrodes in the package to keep them from drying out. In addition, you'll notice that they're on a protective plastic sheet. It's important to keep them on that sheet when you're not in use. The lead wires should be connected very securely. So you would put the pin into the receptor firmly and snugly. And I would advise putting them on before you actually attach these to your skin. You would now take this end of the electrode connector and plug it into, we're going to use channel 1 to start with. If you're using the device only on one channel, I do advise using channel 1 only. Now remember, the device is off. You would click, once again, both of the dials, and then you would select the mode that you're looking for, connect the device, the electrodes to your skin, and you would slowly rotate the dial until you begin to feel electrical sensation. And as you're feeling that electrical sensation, you would then leave it at that level, and as your body begins to acclimate or get used to the current, if the pain is not relieving sufficiently, you may increase the rate, the strength of the electrical current. If the device begins to not satisfy the pain or reduce the pain, you would then consult with your physical therapist and your doctor. And again, they may advise you to change the pulse rate and the pulse width. I again thank you for joining us today, and please remember to consult your medical physician.